doctor, give me the news.
At what age do you start losing your eyesight?
Let's talk a little bit about what you can do to prevent it.
What are some of the first symptoms people will have?
Colors can look faded, and the other big symptom is you can get glare.
Coming up, find out if you may be at risk for losing your eyesight. There's another age-related eye condition. It affects more than 50% of adults by the age of 80, or even sooner, as it was for Gail. Let's look at her story.
I was told when I was 5 years old that I needed to wear glasses. Starting from the age of around 40, I wasn't able to read at all without contacts or glasses. Something changed around 6 weeks ago. I started noticing at night I had diminished vision. I went to my eye doctor and he said I had a slight cataract. So I'm going to Dr. Pirnazar for cataract surgery. I really want to be able to see well again, not have to worry about the hassle of contacts and glasses.
Let's see how Gail's laser surgery went with the ophthalmologist, Dr. Jonathan Pirnazar, at the NVISION Laser Eye Centers in Laguna Hills, California.
Gail is extremely farsighted. She also had a cataract, and the cataract was really blocking her vision. So, today we're going to use the LenSx laser. It's going to break up the cataract for me. It's going to give me more precision. And then the second thing is this new lens you're getting is going to get you both eyes good for distance and both eyes good for up close, and eliminate your need for glasses, hopefully 100%. All right, Gail, so this is that LenSx laser. We're going to hold our eyes open. There's a suction ring that's going to come down, and it's going to get the laser centered here. Okay, suction. Excellent. This is the cornea. This is the cataract. This is where it's going to break up the cataract right here. All right, here we go. Laser starting. Now, these crosshairs you're seeing, it's breaking up the cataract as we speak. Perfect. We're going to now take the cataract out. This is the most important part that the LenSx does. It creates what's called a capsulorhexis. That's the tissue that the laser perfectly cut. This is the high-speed ultrasound to break up the cataract and vacuum it out. The lens is actually a soft acrylic material. We just inserted the lens. Gail, you did it. She can be seeing better in one day.
It did not hurt at all. It didn't hurt a bit.
We have Gail and ophthalmologist Dr. Jonathan Pirnazar here with us today. Thank you both.
Thank you.
So before we delve into this, let's explain to everyone with our giant eye what in the world a cataract is to begin with.
The cataract is actually inside the eye, so it looks cloudy here, but in reality, when you see a patient with a cataract, it's not looking like this. It's kind of like you can peel this away, and the cataract is behind the pupil. So if you look at someone, like the black part of their eye, it'll look white, or it won't look black per se.
So instead of black, it's more opaque.
Opaque,
which is
exactly.
a sign that that lens is no longer letting light through like it used
Exactly.
to, which you clearly noticed.
Yes.
So tell us about this procedure.
So the great thing about this procedure is we have this new laser now called LenSx, which is actually able to create the incisions for the cataract surgery. Here, the suction ring is coming down, it's holding the eye in place, and it's making the incisions now to perform the cataract surgery. So it's adding safety, precision, and accuracy to the procedure. You can see though that kind of X, it's kind of starting to break up the cataract into quadrants there. And then you can see the primary and secondary incision that are made by the laser to treat, so I can go in and take the cataract out. So what this laser is doing is it's making my incisions for the cataract surgery, breaking up the cataract, treating the astigmatism. I still have to go in with my instrument and take the cataract out and put that new custom lens in for her, the multifocal lens to give her distance and up close. So she's essentially glasses free now. She doesn't need glasses for driving, watching TV. She doesn't need glasses for reading. So the whole presbyopia thing you were talking about, we're able to treat that with these special lenses now.
How are you doing? How's your vision?
That's great. It's really convenient.
Were you surprised? How long did it take, the procedure?
It's about 7 minutes.
Is that not amazing? This is why we cannot stress enough. If you're losing your vision or noticing anything abnormal, get your eyes checked out, because so many things are reversible. And best prevention measures we talked before are just eating a really healthy diet, sunglasses.
Oh, yeah. Lutein, zeaxanthin, all the antioxidants, fish oil, they're all great for the eyes.
Well, thank you so much for coming today.
Thank you.
Great job. Gail, we're glad your vision is improved. Thank you for sharing with us and coming up.